John, why don't you come on up and I'll let him kind of give you a little background on it's just his health problem.
Well, I've had some problems with my health for the last 30 years or so, and I suspect that my tonsils may be culprit. I've had some constant tightness in my chest area, and then recurrent throat problems. And that's about the majority of my complaints. But I've never been able to get rid of them. I've tried everything, TV, acupuncture, everything I've tried.
Okay. So why don't you relate to the story? John was the former owner and editor of the Acupuncture Journal, and why don't you relate to him why you got rid of your journal, because you're getting low energy and you were not feeling well.
Well, it happened several years ago that my energy was, the level was constantly going down, and I just didn't feel like I could go on publishing the journal. So this is why I sold it. And ever since then, I've been always searching, and hopefully we have found it now.
Okay. Well, I treated him, and the first thing we did was to remove the residual arthritis areas. I believe there were 5 of them, and 5 surgeries. And we made an improvement, maybe what, 70%, 75%, something like that. But that's still, we need to go a little more. And John hasn't really engaged in any detoxification procedures or anything like that, have you? I don't think so. Okay. So why don't Bill, you want to ask him questions and get started on your protocol?
Okay, what injuries have you had in your life? Starting with birth.
Yeah, well, I had, one of my major sicknesses was I had diphtheria. And then when I was about 7 years old, I had scabies, which was pretty bad. And about 25 years ago, I had an operation for slip disc.
25 years ago.
Yeah. That's about the major ones.
And dental extractions you've had?
Oh yeah, I've had that done recently.
Everything?
Yeah, I'm just about finished.
You mean everything's been torn?
No, I had 17 okay. And mainly because of running mistakes.
You had diphtheria when you were how old?
About 5 years or so.
When you were 5 years old, and how long did it take you to recover, and what therapy did you have?
I don't really remember that. My mother told me that they thought they lost me, that I would not make it. So I must have had it pretty bad.
Were you kind of a small child?
Yeah,
Weak?
I was always sick and sickly something.
A lot of colds?
Yeah.
And then what was that? Then you had scabies that was real severe. And
Yeah.
how did they treat that?
I wouldn't really know, because that was about almost 50 years ago. They used some black cell, some black ointment. That's all I know. And it had a tar-like smell.
Okay. Then we had a herniated disc.
Yes.
Did you recover fully from that?
Yes. What happened is, after the operation, my back pain returned, and I didn't really know what to do, because I was worked for about 6 months and so on, and I was at the end of my wits, and then I discovered an acupuncturist, and he was really quite successful to help me get rid of my pain.
Okay. And what fractures have you had? Sprains?
I haven't had any.
And how many times have you been knocked out or hit in the head, bumped your head?
No.
Dave, were you a boxer?
No.
Have you had any allergies to any drug reactions, allergies to anything?
No, nothing.
What else have you been real sick with or been a problem in your life?
Oh yeah, well, I have some minor complaints, and that is I have to put this contraption in both hands. I used to have an operation for it, but it returned. It didn't really do any good.
Okay. And do you have a good appetite?
Oh yes.
For breakfast?
Too good sometimes.
You have bowel movement or 2 a day?
That's quite normal.
Okay. So main complaints are Well, you're saying, I think my tonsils are off,
Yeah.
but your complaints are tightness in the chest and
And a constant dry cough.
constant dry
And I
cough.
think that is caused by that pressure, feeling protected.
And how long have you had that?
Oh, ever since I can remember, at least 30 years or so.
What therapies have you had for it?
I tried several things. I tried IABDM and acupuncture. I tried chiropractic, just a lot of different.
Nothing on all of it? And you don't take vitamins?
Oh yeah, I do.
Okay, but you haven't had any chelation or anything
No.
fancy? Okay, so when does the tightness of the chest occur?
I have it mostly in the evening. And funny thing is, it really gets severe when I try it when I drive the car. Then I have it right notice.
How about going up steps?
That doesn't seem to bother me.
How many times do you pee at night?
Never.
None.
Just get up in the morning.
Does it get worse if, like, you go to the state fair and walk around all day? Will this tightness be worse, or will it be worse the next day, or
No.
what varies it?
The only time when it seems to become worse is when I go to bed at night, when I wake up in the morning, and when I drive.
It's worse when you go to bed,
Yeah.
so it's best in the morning. No, it's
No,
bad in the morning.
It's bad during the night.
It's bad during the
When I get
night.
up, and it seems to slowly improve.
Okay.
John, can you just for a minute, could you repeat exactly the sensation that you feel in your chest?
It's not that I feel any, but I have the sensation of tightness, that I can't really breathe as well as I should.
You're playing out the walls. And what was
What I did is, we did change bedrooms, because we thought maybe that might have something to do with it, but it changed the situation. Yeah.
What did you say about your throat that you had?
Well, I do have recurrent sore throats. When I do have a cold coming on, it always manifests itself in the throat first.
Do you remember when you were a child, you have a lot of tonsil problems with your
Not so much that, but I think since I have diphtheria, my tonsil may have been infected.
How do you want to tackle it? Do you want to make your protocol so that everybody sees how everybody tackles the situation and we sort of
Okay,
get together?
fine. Your questioning, though.
¿Por qué no hacemos una cosa? Que él le haga, ya le hizo su cuestionario. Hagamos de nosotros el nuestro, y hacemos la reflexión. Hagamos el cuestionario.
No, I only have it like that when I have a cold coming on, about once a year or so. Otherwise, that's even better. That's always pretty, more or less.
So you put some
Like you might have something. I tried to find, I couldn't really pinpoint it that closely. I noticed that it just depends on the
But you don't wake up in the middle of the night.
But then I do wake up, it's still the same. And then when I get up, it seems to slowly get better.
But you've never watched the secret way that you feel.
No, I haven't had any problems with that.
John, when did it start? Do you remember when it really marked?
It seemed to, I think about 30, 25 years ago when I had my operation with sepsis, then it seemed to become worse.
Would you say that there are any
criticize every single government.
How's your bowel movement? Is it regular?
Seems to be regular, but once a day or so.
No journal watch or anything this one?
I think it's quite regular.
Every day,
Yeah.
every day bowel movement. Any gas? Any kind of indications of maldigestion or bad digestion?
This is what I was going to watch.
Anything that really hits your digestive process? Anything that you cannot tolerate? Do you tolerate fat?
There's one thing I cannot tolerate, and that's seafood. Cream, shrimp, and mustard. So,
Have you ever been a big pork eater going back to childhood?
after the war,
In your old days, pork meat?
after the war, when I grew up, there was that shortage of food, so we were actively for days.
I live a good Since that disc operation that you went through, from that moment on, you say that things changed.
They worsened gradually.
They
Nothing
worsened.
like a pinpoint, but over the years it goes.
Any other surgeries since that disc surgery?
Yeah, I had surgery for the
Contraction.
Yeah.
In the appendix, John.
When was your appendectomy?
Oh, yeah, that, long ago, but that was about,
After the disc?
yeah.
The first surgery at all was your disc problem?
That's it,
La primera cirugía fue la del disco, después de la appendectomía. And the transcontractures were after the appendix?
No, that was giving birth.
Before the disc also?
No, that happened after the disc problem.
Discal, contracciones de distribuidor y appendix.
Nobody ever checked those, so this is what
You still have it?
I have it, yeah.
Fractures,
No, nothing.
sprained ankles?
I never seem to have had any complaints with that.
John, do you remember in your childhood that you went through all the diseases that you normally
Yeah, my mother said I did.
Todas las enfermedades. Would you by any chance remember any one of those was
do get it, it's here.
que antes sí era un impuesto que no tuvo nada para que pudiera ser para anytime that we remember that we had those codes that seemed to catch very easily, remember if any one of those codes turned into a more severe problem, into pneumonia or bronchopneumonia or whatever.
Fumador activo.
Have you ever been a smoker?
No, no.
Only a passive one? Or-
Yeah.
Okay.
Esta hay taquicardia y dificultad a la
When you don't have that constraint here, and you feel good, and you go up the stairs or wherever, you make any kind of effort, do you feel any kind of tachycardia or short breath or whatever? Have you any history of high blood pressure or low blood pressure? Hepatitis? Typhoid fever? Any kidney problems in the family or in yourself? Any venereal diseases in the past? At any moment, when you have the constraint and when you don't have it, do you ever have any kind of joint problems in your hands, in your elbows, or knees?
No, I do have the tendency, I have to watch myself when I do fall asleep. I always have my hands on the
Any skin problems, infections, eczema, breakouts?
except for the scabies.
If you just think a little bit on your father's side and on your mother's side, which would you say has been the pathologic tendency in both families? Father's side, has there been any cancer or heart attack or diabetes or kidney? And on mother's side, just give us one or two.
When my father died with heart disease, 2 years back, but my mother is very healthy, she's still around at the age of
El padre murió de la cardiopatia pulmonar la madre tiene 86 años y está
Can we ask just any questions from the floor at all? I just have 2 questions.
I don't even know. Now that you bring it up, I haven't even noticed it on myself.
The 2 questions I would have was, first of all, if you've been exposed to anything, I just think it's very tangential, any grief when he was quite young. And the second thing I'd like to know is whether it's been in any job that's a nervous thing there.
Oh, yeah.
I want to know whether he's been exposed to toxic chemicals or whatever.
Well, you have a very good point here. I did serve my apprenticeship. I used to be a print by trade, a typesetter. And at that time, they were still dealing with type which was made out of lead. So I was exposed to that for about 6 years or so. Yeah,
just being in the lead.
How about the grief? How about any life emotion that's been
I
a
haven't
severe?
really had any serious tragedies in my life at all. I've always been reasonably satisfied.
How come?
I don't know. But just lucky, I guess.
feel when you have something tight around your neck?
I can't stand it.
What does it do to you?
Well, I just try to go without having to wear a tie.
What symptoms do you get when you do it?
Oh, well, that feeling of tightness becomes aggravated.
Any more questions on the history?
If you lie down during the day, do you get tightness too?
Yeah. But not as
Anytime you lie-
bad, not as bad. If I lie flat on my back during the daytime, I will feel it slightly, but the really severe condition only comes up at night.
Is there any
Yeah, it's that dry coughing, trying to get some air. So that's some kind of nervous coughing, that's just.
If we get you better right now, how will you know what change will occur to you?
Well,
What are
I
you
probably
looking
would
for?
feel better, but I think maybe I'll probably notice that at night. Or when I drive the car.
So you wouldn't be able to tell right now yourself so much.
No, not really to a great deal.
And you couldn't do anything to bring on this chest tightness to test it, like after we treat you?
Yeah, I drive around the
Okay.
block.
Really? It'll come that quick?
No, it takes a while.
Like an hour?
Yeah.
2 hours?
No, not that long, I would say about 10 minutes.
Oh, really? So you can just drive into town?
Do you feel better with the windows down?
That doesn't make any difference. I tried it. I heard about when I had the symptoms just as bad as if I driving.
You ever had a car accident?
Yeah, I did, but not serious. I wasn't interested.
Was it your fault?
No,
Were you hit from behind?
no, what happened is I ran into someone who ignored the stop sign. Well, at first I was in the hospital for a few days, luckily she was not killed. But nothing happened.
What kind of shade do you see? Is that water?
No, regular bed requires springs.
Are you really electric?
I don't think so, not anymore.
Would you, in consideration for our excellent treatment, would you consider, you have a car here?
Yeah.
Consider going and driving 20, 30 minutes afterwards and come back and report to the group? Because that's significant to the group to see what type of result we got. And it's also significant to ourselves because we're looking for an instant with this type of a thing. And it's also significant to yourself because it gives information on the next treatment, where you should go from there. Did you have some comments?
Drive off and get back.
Did you want to start now, or?
No, what I would suggest, that's what I thought you were just suggesting, let John get out there and take a drive for 10 minutes.
I don't think that's.
So he has pain?
Because, no, there's no pain, that's the funny thing, we never have any pain.
Well, we're in the treatment now. How would you like to start? Or discussion of what we just got?
Why don't we discuss it, you do your part, somebody else do what we did yesterday, and
Okay.
fall over him and
You'll be on my tail and show me up, okay? On the end. Well, I'd like to discuss a little bit about him. First of all, we've got tiredness is really our #1 complaint with chest tightness, which occurs starting when you go to bed. It remains, he wakes up at night, he still has chest tightness, he awakens to chest tightness. There is some cough at night. And it's been present approximately 25 to 30 years. And at times you get hoarse,
Yeah.
but you don't relate that to anything, and just the times you get.
It comes and goes. Mainly, it does happen when I have to talk, for a while. And usually it happens when I have to talk to strangers. If I talk to my wife, I never have. It never happens.
And then we had a fatigue complaint. When is that?
Well, I used to have that quite badly several years ago, but I would think that's probably due to my problems in the mouth, which have been rectified now.
So you don't have fatigue? So you don't have fatigue now, or you still have fatigue?
No, I feel a lot better now. I feel a lot better. As far as the energy level goes, I'm slowly becoming, I'm going back to normal.
And you've got some sinus?
Yeah.
Okay. So we got some sinus, we got some hoarseness at times, we got some coughing, predominantly at night. Hoarseness occurs with mostly speaking. The chest tightness is relieved by nothing and seems to be aggravated by driving in a car and at night when you're horizontal, apparently, and no other times.
Bill, he's been under care, dental care. What have they done there? What have you done there for dental care, Ed?
I didn't come prepared to answer all the questions, I didn't review it, but basically we cleaned up all the status, we moved the non-vital teeth, and we did some surgery areas, and cleaned them up, and,
They moved alloys?
yeah, we moved all the alloys. He only has the gold portion of his mouth. And dentistry is not stressing.
Has he gone through a detox program anytime?
No, he hasn't gone through it.
When you were 12 or 13, did you have any dogs or cats?
Yeah, we did have a cat, yes. But we never had any dogs, no other animals. Oh yes, we did have a couple of birds. Parrots, yeah.
Just chest tightness, does it occur when you're away on vacation, and you're sleeping in another bed in some hotel or wherever?
Yes, it does
Every
happen.
night.
It does happen no matter where I go. We used to go to Australia and New Zealand, I had just a bad day.
Okay, let's top off the questions before they call us classical homeopaths. We go into a 4-hour thing. I think we got enough to work on. I think to take an empirical approach, although I want to ask his body some questions if you'll let me, that its tightness is his overall predominant thing with all our questions as far as his complaint. He's had an appendectomy surgery, he's had a lumbar surgery, and he's had some surgeries in the mouth, of course, as we all do. And so on an empirical basis, remember with this rope that I keep throwing to Peter, I said the problems tend to be at the end. Well, that's true, but let's change this rope that I threw to Peter. Put this thing in between it. And that's representing a peak. And so the problem will tend to be at the ends, and osseous tend to be at the bumps or at the peaks. So we've got feet and we've got head, of course, are our ends, but here's one of the real most common areas for them to feel torque or tension. So knowing that, I would say what I'm thinking of is just do a rather empirical scar clearing and see what we get. So want to step into my examination? Just lie down and on your back, and if you would take off your glasses.
Do you want any gloves or anything?
Yeah, I'd like some gloves. On your back. And just under your pants, and forget that you have your wallet. No.
Or the treatment.
You just leave them like that. Just don't let them loose. Yeah, just one at a time. I don't need that. I don't need that. I want. Okay.
There's something else I should do.
we also have a Dupuytren's with a surgery. We have lead surgery. I'm going to go in the mouth, if you could open up. Okay, we got trouble right here. I'm not looking at his eyes, but we got trouble here. Right here, I'll tell him where it is. It's from here to, well, it's here, 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 to here. There's trouble. Now, that may or may not be in a sensorium. I don't really care so much. But it doesn't pass my scanner test. It's my test. I'll tell you what I'm feeling. How long ago were all these dental surgeries?
It's recent.
Okay, let's just scan. Yeah, he's got some exostosis and it's pretty dang rough is where he failed his test in this area. Does that hurt, John?
No.
Is that a yes?
No.
It doesn't hurt. Well, it doesn't pass the finger test. So I would say, get it.
What are your exact
I just buccally on the lower molars, which are gone, and lateral, and it's bumpy there. That doesn't hurt, John?
Yeah.
He says it doesn't hurt, so it's below a sensorium. But these are so easy. Yeah.
No, I don't think, now, he had some teeth that were already missing. That may be it.
So I don't know if that's like a leather or anything, but I don't get that. His nose is symmetrical. So why don't we ask his body? Can we ask you some questions using your muscles?
Yes.
Okay. On 3, I'm going to push this way. Would you just resist me?
Okay.
Okay. 1, 2, 3, resist. Come on, give me all your strength. 1, 2, 3, resist. Now touch in your mouth there where I was touching. Right on there. Okay, 1, 2, 3, resist. Come on. You weren't ready, I know. 1, 2, 3, resist. Okay, his body's saying a real strong yes. 1, 2, 3, resist. Yes, meaning there's a problem. Now, since we're doing some muscle testing, let's just go over them kind of quick. Okay, he's got some color still in his scar. And we're going to take a picture of it, but it's very unappreciable. His umbilicus is symmetrical lying down, but it doesn't mean anything lying down because most of these scars are standing up. It doesn't seem to respond there. Doesn't seem to respond there. So would you touch your appendix scar? Let's ask a question there. Okay, 1, 2, 3, resist. Okay, good again. 1, 2, 3, resist. Okay, touch your back scar. You know where it is.
Yeah.
Okay. 1, 2, 3, resist. 1, 2, 3, resist. So nothing there. Now touch your Dupuytren's.
Yes. So that's 1 first.
1, 2, 3, resist. Is that 2? And another one?
The other one. He doesn't both have.
Yeah, I got him in
1, 2, 3, resist. So those are off. Okay. Okay, take your arms off. We're looking at the bite then. 1, 2, 3, resist. Do it again. 1, 2, 3, resist. There's a bite there. It is so look at this as a baseline. Is that as far as it goes, John?
Yes.
Okay. And now abduction. Is this as far as it goes?
Yeah.
So note the foot is about umbilicus in both extension and abduction. Checking the ends. One of his ends. Seems pretty good. Looking at his shoe wear. Looks good. Looks good. Don't walk in the dog shoe. Does that hurt?
No.
Nothing there.
I'll take the soles,
Well, I'll pay everything, you know, the more places you get your fingers, the better off I guess you are on that type of stuff. So if it's okay with you, John, I'd like to do some, go in your mouth in all these areas and correct it with a little injection.
Sure.
And if it should get too intense, because the hands are quite tender to do, we'll just tell me to stop and we'll be conscious. We'll stop. But you really won't have any, problems other than temporary pain. You could have bruising. That's all right. You really won't have anything. Let's see what we get. Okay.
Do you want me to get up or can you?
No, you can stay. Oh. He wants touch right here.
Yeah.
Let's see. 1, 2, 3, resist. Okay. 1, 2, 3, resist. All right. You haven't touched the thyroid. 1, 2, 3, resist. Do it again. 1, 2, 3, resist. Got a bite on it. Well, you can always do those. We're getting into organ dimension now. Okay, so.
You want to start with the mouth or?
Yeah, I wonder, do you have any little ones in a trachea? Or do you do an odd chain?
Yeah, we'll have to.
How about a little, like a smaller, but you won't have more through?
I didn't bring a ½ inch. That's 1 inch. It's only 1 inch long.
I know what this is, but I want a different one.
Building, before you do this, you want to have our early examining the system doing once you start doing.
Okay.
Si quieres examinarle algo más antes de que él empiece a tratar, porque si no después ya no tiene chiste.
Listo. There's something I should mention, and that is Dr. Arana gave me an injection in the tonsils last week, and I felt so great. I felt so good the whole day. That pressure was all gone.
Did everyone hear that? Well, last week he came in the office and we did the tonsil, and he said that relieved the pressure. He felt great. How long did you feel great? All day. All day, yeah, he said all day, but into the next day?
Yeah.
Yeah.
What about 24 hours?
24 hours.
La única diferencia es que al llegar a tratar de limitar, que tiene un anillo de función, puesto que, o sea, las emociones reprimidas pueden causar anillo de función. ¿Por qué pienso eso de los resultados de Alexander y doctor? Porque pienso que primero por toda su vida, por sus hits, por el hecho de que las situaciones de tensión le hacen llegar más eso.
Arturo is saying that
Sería la única cosa que trataría.
the only variation you would
Le haría de todas maneras una interconsulta con la psicóloga del centro para que me evaluara cómo es eso.
y mírame la boca con el criterio más nuestro del motivo, que hay unos dientes nuevos. Mírame por acá. Mírame por aquí. Okay, he says that from his point of view, he doesn't like his mouth at all, what he's seeing in there, you know. This canine here, this condition is the one of the which is being used, I guess, as a support for his partials or whatever. Over there, they would go. Our place. Another thing that I have been able to switch this off.
Well, yeah, I think it's a lot.
No, it's okay.
Wasn't it like that?
No, it's
Can you,
okay.
let me just see it. There are different types of okay. You don't see it. Well, anyhow, another factor that he says.
Haríamos una evaluación por medición mucho más amplia.
Yeah. We would go ahead and make a very thorough test to see if those teeth that apparently seem to serve the purpose of helpers for others, but not for their own, if they deserve under an overall condition to stay or not to stay. Second thing that he would add is that because of the constriction at this level, he would try to see if he has a constriction ring, according to our, Alexander Lowen, because it seems that the situations of stress, driving, emotions, have that constriction, especially here on this side. If there are many emotional factors that really unchain this constriction, I would make an interconsultation with the psychologist that we have in the center working with us for this type of help. That would be the only different thing that I would do from a checkup point of view.
So, did he find anything else for it?
No. But it's very specifically here, And those rings are at those levels. The one here, the other one is here.
Las tensiones de tipo, las situaciones tensionales, como por ejemplo las de preocupaciones de trabajo, de ejercicio mental, etcétera, producen anillos de tensión a este nivel.
All the worries that are derived from work, from responsibilities, etc., they produce tension at this level here.
Las tensiones relacionadas con situaciones más de orden afectivo, de golpe carencias afectivas, que es lo que él puede haber tenido en la
Tensions that are more related with emotions, with affliction, affection, lack of them, or too many of them, they normally hit at this level here, like a ring.
La situación de que todas sean vivas haría que con la psicóloga preguntara sobre su infancia.
Since he has his tolerance a little bit depressed, if you look at it, it's not only the compensation with the little belly, it's just he has a depressed tolerance. That would motivate me more to go into the conversation with the psychologist, to dig a little bit more into childhood. Él le gustaría escuchar la simetría de la espalda, tanto de pie, también la balance de todo.
Pero es que muchas veces esas asimetrías son secundarias a las situaciones emocionales.
The thing is that type of asymmetry might be the secondary effect of emotional constraint. Yeah, of course, that's a combination.
Ahora, las tensiones a nivel lumbar generalmente están relacionadas con la esfera sexual, con problemas con el cerebro del
The lumbar constraints here have normally something to do with the sexual sphere, with what volumes call the pelvic range, which is this pelvic triangle here.
Recordemos cómo el anillo de tensión detiene el flujo energético hacia arriba y las mujeres se vuelven caedoras por falta de satisfacción sexual.
Remember that the tension ring is the one that's here, and how women become like forces like this here because of in this case, we necessarily need the hand-by-hand cooperation of our psychologists.
Why don't we just put it on here and hold it?
I have a question about when you're taking information and deciding what to do. And he said that he was rejected from talking 24 hours, he had total length acceptance. So is that not a likely reaction for him to have your focus and change?
Well, that's one thing that is gonna be taken into account now. Definitely, I mean, that's a very important sign that we get, yeah. But we're looking at other things that have to be taken care of too, because he has too many aspects in the approach. That is definitely a fact that cannot be let out of sight.
But in your logic, would you be thinking then that that would be the tip of the iceberg and the others might be multipliers? But with the lightning reaction, I mean, anytime you see 24 hours of complete deliverance.
I want to spend one more in this.
What are you putting in there?
1% xylocaine, nothing else. Astro.
Okay, 2 cc's, and then the rest saline. I got saline.
You can just say that.
Es decir, si estuviéramos en los territorios deberíamos repetir los polos a ver si el efecto cada vez va mayor. Si no hay que pensar en campos sociales.
Well, you're absolutely right, Melissa. I mean, if we were sitting in our office here and not causa demonstrandi here, you know, we would definitely, as first thing, take down all the history. It's a must. And then, if that helped once, the first thing we would do is just repeat it and let it go. And let him come back in 2 days and say, well, how did you feel after the second time we injected that? It might be very light, and then we know that those other foci or those aspects we're looking at might be only secondary. So that would be the proper protocol if we would be at home with him, with the information we have gathered so far from him, and with the background that he was injected last week, you know, and had a very pleasant day.
Would it be of benefit to go to your homeopathic for diphtheria, fix that with your propane to do the drug?
La mezcla genética me podría para provocar más diphtheria que
Ahora, normalmente, por eso pregunto si hubo, me gusta preguntar muy específicamente si hubo sarampión, varicela, pneumonia, papera, etcétera, para junto con incluso colocar todos los nosotros de las patologías.
I always insist on the children's diseases, infantile diseases, because if I get an appropriate answer on that, together with the lymphomyosome, I mix the nosodes of all those diseases, measles and whatever they get in their child. Not just an autohemo injection together after the consult.
I thought it was just diphtheria with his history. He said he doesn't remember it, but his mother was fearful that he almost died. So he may not be conscious of that, but he says when he gets uptight, then he feels this constriction. This is where he had diphtheria.
The emotional constriction.
He may not be intended.
And you see that there is a slight impression of the chest. Yeah.
El cuarto nivel generalmente es por sobreestrés de trabajo. O sea, hay trabajo físico.
The fourth level is just a strain due to physical work. I mean, the classical excessive physical work that produces that stress at that level. Yeah.
Generalmente uno pasa la mano marca y él no se deja poner.
And if you want to know, if somebody has one of the rings in the back, you just use the Kevlar folding. The Kevlar folding is just enroll, and if there is a ring, you cannot do this here. This thing doesn't come out. It's sort of just sticking to the bone.
Está pegado, que la calle al tejido se enrolla.
It's stuck to the subcutaneous cellular tissue.
Siempre donde haya mucha retención, la piel está pegada.
Touch your appendix now. Touch your different veins. Touch your other two veins. Touch your back. Touch your sinus up here on the top by your eyebrow. 1, 2, 3, resist. Touch your sinus below. You were out farther, remember?
Here, John.
Oh. That's it. 1, 2, 3, resist. Okay, now put your arm down. Well, why don't you sit up and tell us how you feel?
Can you give a report of what you projected? There's two things going on at the same time, so I think that.
Okay, he needs a little bit of time to see how he feels. What was the first step? Preservative-free lidocaine?
Yeah, 1% aspirin, Salvagate, straight.
Okay. And then we did a little autohemo. We pulled it out. We shook it. And then we did his appendectomy scar. We did the area that I didn't like, but he said it was okay. And his body was also weak on it, on muscle testing in his mouth. We did his surgery scar on his back. We did his surgery scar on his hand, left Dupuytren. We also did the right Dupuytren. There's no scar there, but he muscle tested weak when we had him touch it. And we refilled, because we used 10. When we refilled, we used 2 of preservative-free 1%. Then we used secret formula, 0.9 normal saline, 8 cc's out of the glass bottle. Succussed. And then finished up on those scar areas, and you see we got a domino on his sinuses. We never touched his sinuses. And we got about, what, 5-6 inches increased abduction and extension, wasn't it about that, with the foot as compared to before, and all the areas turned positive, strong. And what do you have to say?
Well, I cannot say. I seem to be able to breathe a little better. That's about all I can notice right now. Think there's any other change besides that.
Okay, the doctor here is going to show me up. I want to go over you one more time in a little different bit of a way. I'm trying to make this more like an office, how I would do in the clinic, and go a little bit faster rather than have it more like a medical school case. So line me back if you wish. Okay.
Can you just talk through what you're doing?
Well, I'm kind of doing a cranial on the feet. And I'm just reading tensions on his body. It's somewhat of a, it's kind of hard to say. It needs memory construction. But I'm kind of scanning him by feeling different tensions.
Bill, did you inject the tonsils?
No, I didn't touch it.
Why did we do it?
Why did you do it?
Because John studies fields of disturbances, and he came in and he thought that he'd like to see what would happen when he had his tonsils injected.
Why does he inject him to die?
They'll get to that.
Right now.
Well, not
Is that right?
first of-
Right here. Right here.
No.
Okay. What I'm gonna do is a dural torque release, which you saw me do yesterday, then straightforward. Gets like that. We go on C2 with our superior hand. C2, you know, has the big knob on it on the spine. We do the sacrococcygeal junction. We ask him to inhale. And exhale. Up on your caudal hand, down on your straight. Deep breath. And out. Sink your breath with it too. Take a deep breath. Let it out. Again. Out. Again. Let it out. Again. Let it out. Okay. Lying your back down. Well, I would call that a first treatment. I could do more. He needs more done on chemistry, but I don't really want to get into those planes at this time because there's so much with that, and we want to stay in more basic neural mode, right?
We can see how he develops.
Yeah, we've got enough, at least for me, but now you want to do them, or do we want him to turn him loose and then you follow after he drives? You want to do his throat?
Yeah.
Okay, doctor wants to do his throat.
What if he get the neural points on his chest? Like
See, that's not where it is.
I couldn't really get him to kick off on local, for one, so I think it's coming, I think that's just a reactive area.
Is his right leg longer than left?
Do a little bit.
Okay, so you're saying to feel it in your
No,
brain.
just enough to see that it come out.
The one that also treats part of the body with the symptoms.
No propane, just lidocaine.
But yesterday with you, they treated
Yeah, so
your
you're
symptoms,
camera.
and then they went look all the other stuff. Yeah, but that's where you're.
Hold up our toe, we want to show it on camera, it's not on here.
All right, well, but I think that this for.
Need more duct tape.
Where's the injector? Gets swollen.
Like superior fossa.
Where's the injection being done?
The lower pole,
That's dark.
Y como hay positivo las amígdalas le harían barrido.
since the tonsils gave you a positive, on top of the tonsil, the conventional tonsil injection, I would do the lymphatic, just the papules on the lymphatic chain.
You feel good? Does this help extra much? Enjoying the growth better?
Maybe tomorrow we do crown of thorns. Quality of the voice change? Quality of the voice change?
I thought it did.
Tonality?
Because the lens.
How come you don't do the stellate
goes
ganglion?
one side.
It's so good for the upper part of the body.
The left side.
Well, what do we have to
Yeah.
say to do it?
We'll do it thoracic.
I like doing what we did.
Huh?
In fact, I think it's a little more elegant in a way not to make your face totally shot up. Although you do get a pretty shot up. If they get needles, the 150 sticks, they get a little needle shot.
Yeah, the vertical ganglia, she stimulated the vertical ganglia.
How long have you been seeing Dr. Ron?
The inside blockade,
Talk to the microphone.
door squeezing as we call it, which is normally done on both sides. I didn't want to be more aggressive with it after all this is the sluts, you know, like, so then, both sides, yeah.
Could you just tell us what you feel or think, anything that comes to mind now?
Well, I feel pretty good now. As I say, I don't really have that tightness during the daytime, when usually at night, so I cannot say whether that has improved or not. I am able to breathe a little easier now.
How many think his voice has got different tone qualities
It
than
does
what he
seem-
had before? How many can't tell?
It's more relaxed.
Yeah, it does seem like we have a better voice. Can you tell?
Yeah, I think you're right. Yes, I do seem to be able
It's
to.
not as growly or as rough. It's got a.
Yeah,
You're turning
yeah.
into a tenor here. We didn't even do your testicles either. Should we take a break and before we start the next one, or what's the plan?
No, why don't we just go right into another one? We have Simon Melrose, another patient. Simon's an engineer who's been into healing, and we got him pretty well cleaned up dentally.
Maybe we'll see you in at least a half hour, right?
Except for some restorations on the anterior part of his mouth. And Simon has narrowed it down to, was it your left ethmoid? And
Okay, why don't you use the mic so it comes on the tape better?
Simon asked me if he could come to the conference and have someone either do sphenopalatine or do the base of the skull, the back part of your nose, right? Yeah. And so I said, sure, we can do that. Why don't you relate to the problems that you were having and what your progress, what we've done, and you can relate to them how you use kinesiology to check yourself.
My problem started probably in childhood. I had data of fever at 9 and 2 doses of Entrol, one which knocked me out for some hours when I was 11. And at 16 and a half, I was given some medication, some salicylic acid on my skin. When I did that, flushed field and got acid shortly after. All sorts of subsets of those. And until fairly recently, the last 4 or 5 years, have I been wandering around in the dark, partly due to head trauma and confusion that happened when I became allergic, and also with chronic infections with tonsils and other sinus infections. And the neural therapy I had Dr. Hofer treat me here last year, and with the test using kinesiology, what points needed more treatment and what points were satisfied, I was able to get really good relief for a lot of the symptoms. The confusion, well, I had trauma, I had chronic thorns a couple of times, and my trauma spots injected on 3 occasions. I had my pharyngeal tonsils injected 3 times, and I had also 3 times my tonsil. And that got rid of the recurrent sinus infection that I was considering 3 weeks, and that I had a reaction, another one, and I snapped back. And that is the last 8 months not been present. I still have one weak spot on me that is inside my left sinus. I went back and I can go my nose or I test right below my eye. It's weak. I've gone to various other points. I had a car injury at a point where I was pushed off my bike and I had a dent in my leg. That was a fairly spectacular neural therapy spot. I had shooting pains down both feet, pains to my heart. And when I had that injected, my energy level came up quite dramatically. I fluctuated up and down, I fluctuated from the high point. The trauma spots of the head, that when I had the first injection done, that got rid of the confusion for a few days, and the next one for a couple of weeks, and the last one it's remained strong, and I can even with an allergic reaction, I can still feel the word, which is something that was impossible before. I'm just trying to think what other spots I've had injected. I had injured my back lifting, having inflamed disc when I hit something like current back pain. I had that injected once, 2 millimeters sharp. And that's taken my pain there, and it's made back strong.
Tell me about your acid treatment and the burning phase.
Oh yes, when I put the salicylic acid on, it gave me an internal heating effect that hardly ever left. Some things would drive it absolutely crazy, like the turn is so frothy. And the most dramatic effect was when the fillings were tightened up. Each time I'd have a couple of fillings out, another fillings, I'd go through a honeymoon period where the place would go into refrigeration and it was very, really cool and nice pleasant. So the fillings are in there to some extent. It's now sorting out the damage that's happening subsequently.
Okay, does Arturo or Bill, you want to do that?
My vision's not affected. No, it's back, that's a little bit further down. But in there somewhere.
Temperature changes affected?
No, I'm fairly temperature tolerant. I usually wake up in the morning with the sinus pain. If I have an allergic reaction, my nose will go from a fairly open state to slightly more constricted, and the pain will become more intense.
What drugs are you allergic to?
That I don't know. I haven't had a history. I don't have a history of being allergic to drugs. Most other things I have been allergic to in the past, but my sensitivities to most things have been altered dramatically each time I've had a immunotherapy shot. My range of foods is like by a step or two, my sensitivities to
So you're allergic to foods?
I used to be allergic to it almost everything.
Okay, we got a danger patient. What I mean is, when you have somebody that says that they're allergic to food, consider them allergic to drugs because they just don't know it. But consider them, he's about a 13-foot-4 kid, they say they're allergic to food. So, you can make sure that he only has the saline out of the bottle, whatever they have. What was it? Salad. Cartwheels, you don't get any of those at all. Because, well, these people are in trouble. If you have God on your formulas, otherwise they can get sick on you and have respiratory problems and everything. That's why you try to do a neural therapy, and then they're scared of you and then you don't cure them. Because when you pass out on you, or felt like crap is the most common thing. Allergic. You're sick to his stomach, feel like crap, headache, or pain. What you can do is not on the dot of the formula. Let's just start.
Now, as you approach now you're interested, you feel that you've localized on the side of your nose, the side of your right nose. Now you want to approach that on the surface or on the inside.
That we were just talking about it. So more than anything, what he needs is sphenopalatine ganglion, which irrigates this whole area.
Okay.
On that point, I have had the ones around here. They've given morphine relief to
¿Lo vas a hacer now aquí?
No, primero lo voy a now
Yeah. Why don't you just lie down? He wants to palpate your face first.
Now you would use just xylitol.
Yeah. But out of the ampoules, not of the cartridge. Because this one has preservatives.
rosary, I'll translate. He's got a little bit of a lymphatic rosary. He's got some stress rings. He's dark in around the pupils, so he might have some hydroxoric. And the doctor's an expert. He's going to say some more stuff on that.
Between 1 and 2. You got 2 open lakes of substance, of lack of substance. That's exactly the area that corresponds to the paranasal, the neighborhood, and to the left one. Between 10 and 11 on the right eye, you don't find that same amount of substance. So it is concentrated on this left side. I've seen myself here.
Are they open or closed? Open or closed?
Will that change after injection?
Pardon me?
Will that change after injection?
Tissue changes, so it's going to take months to change. Months to years.
It has taken months to years to change already. To get back objectively, it might take as much time to disappear from that, if at all.
Solo cuando la luna es completamente negra, o sea que ha habido pérdida de sustancia hasta el fondo, cuando nos queda ya la base aquí, es cuando estamos en presencia de un proceso de ya no duele. Pero la laguna, en la medida que mejora los sistemas, debe ir cicatrizando hasta el país, quedando como solamente una pigmentación blanca.
From an iridiology point of view, those lakes that have very sharp edges and go all the way when you look up to the bottom and you don't have any substance, they do not seem to have the ability to replenish, to refill themselves. But if it is only a lack of substance that you see as a whitish terrain, the more the symptoms disappear and he is sort of driven back towards his own equilibrium on that side, it might, after some while, come back and replenish, just leaving a white sign in the neighborhood. Queremos un momentico la topografía donde se hace exactamente la lista del...
No sé.
Ok, yo acá en el arco sintomático,
Psychomanicar.
entonces,
Well,
es mi punto.
Right in the middle,
más cerca.
if you open your mouth, you feel that there is, the gate opens to the entrance for the stenopalatine or pterygopalatine cancer. You divide this trajectory in 2, right in the middle.
Below or above the arch?
At the level here,
Por encima del arco sintomático.
just above the psychomatic arch. It is a painful spot actually. If you do like this here, here it is.
Come over here with the.
It is a painful point actually.
Bring it over here. And then,
Just divide this here. Open your mouth. Here. This is an unpleasant point.
on this one, we got
Yeah.
and that's the ties to the entrance.
The patch is
Run through it again.
and never inject the patient with his mouth closed.
Bring it over and show them
Yeah.
with the camera, and that's before you do that one. Show them.
He's done it. He's done it. No, he didn't do it.
Ya prefieres que le digan al paciente que te abra la boca, si no, no le entra la
Show them what here.
Focus, focus.
I mean, you gotta turn it, turn it, yeah, there you go. Turn it up.
You in this direction until you make bone contact. After about an inch, less than an inch. And then don't scratch it. Go back a little bit, correct your position about 45 degrees, and go in direction to the opposite wisdom tooth. And you can go with the 6 centimeter needle, you can go almost all the way. And you enter injecting. Otherwise, you won't be into the ganglion. You will be at the level of the fossa, of the pterygopalatine fossa. I always ask the patient.
Ahí ya toqué el hueso.
Yeah.
Entré y toqué el hueso.
You see, he went this way, and he already touched, made bone contact. He goes back a little bit,
Retiro un poco.
and
Cambio la dirección.
in direction to the there it is. And so the mouth should always be
Siempre aspiro.
half open, and you aspirate before you eject. The second time doesn't do it on the backbone.
Hice algo llenando todo el tejido para no dejar campo interferente con el chuzón.
And I abandon the place, injecting the rest of it so that I don't leave an interference with the needle.
How do you know which endpoints? How do you know when the needle's where it goes?
¿Y cómo se sabe? Porque la segunda vez no se toca hueso, sino que es el largo de la aguja, ¿no? The second time you don't touch bone. You normally use a 6 centimeter needle. You use, how many inches is this here?
3 inch.
You use a 3-inch needle for that, and you almost go this deep here. I mean, if you have one of the full faces, you might need a longer needle of 8 centimeters. But this is normally what you need. If you have a very fine and very small face, you need this. But the tip of the needle, this is the fossa. It ends here. Just in front of the end.
La forma es saber, preguntándole al paciente que diga cuando sienta presión en los
And the best sensation that the patient will feel when you are in the right spot and you ask him if he's feeling any pressure in his upper teeth. Even if there's somebody from the inside, trying to kick them out. That is the place where you have to land. And never forget to ask the patient to halfway open his mouth, otherwise you will force your way through and you will cause some damage there, If you try it again and you open your mouth, you see that you do like this here, sort of gale, and then you go like this here, and then in direction to the opposite wisdom tooth. And I would even take one that is a little stronger than this one here.
Es una de las funciones y posibilidades de
This is one of the injections that has the possibility of producing a hematoma.
el cual se va a ver inmediato.
And that type of hematoma pops up immediately.
Póngale hielo, gran cantidad de hielo.
What you can do is take some ice and put on it, and take a cold spoon and have the patient hold the spoon on the cold spoon on the hematoma. Because on the way in, you might touch some kind of ramification or vascular ramification, and they make this kind of hematoma.
Decirle al paciente, de todas maneras, advertirle al paciente que no hay problema por el hematoma y que antes es bueno porque es una coagulación.
And one of the things, after you heard what you heard yesterday about the blood, one of the things you have to tell the patient is that he should not worry about the hematoma. On the other hand, he should be grateful for it because it will be a slow reabsorption and you will have an auto-hemo vaccination.
Arturo, ¿puedes explicar en la cabeza que la fibra
want to do his nose and his thyroid.
I think that's a good idea.
Why is thyroid? Well, I get to cheat on Dr. Arturo a little bit, but I saw him last year, and this man looked like crap.
What do you want?
Unless it's 22, he looked dramatically better after Dr. Hopper got done with it. And I seem to notice that when he did his thyroid, it was like plugging you in. But you're looking a lot better. You look better instantly after that.
One thing we had to call out, was me to get that skin change.
If you catch one of them, you know.
What do you think about his skin? It's a big change.
It's a big change. He had a great death cast on him, a hand cast.
I still feel better.
Yes, I will. Where is the microphone?
Here it is.
Okay.
Okay, we saw this gentleman last year with Dr. Hopper, and he really looked like crap. He was a very much of a gray cast over him. And I thought, no guy that has really done it, he would offer somebody with cancer. And if you don't get progress, cancer is in your differential. And it's epidemic. If you don't get lightning the hole, take to the big C is a good one. It doesn't mean he doesn't have cancer, you just start out cancer real small and get bigger. But anyway, when Dr. Hopper did his thyroid, he really seemed to change. And he's got a considerable keratin on his nose. And they both muscle tested. And so it's going to make you got the cane in?
You want just saline?
Yeah, and saline. And let's just do his thyroid in his nose.
Bill, before you do that, did the scale L-team change anything?
Well, I didn't really check him before. Did it change anything?
I feel more relaxed with it. I tested myself and I'm stronger.
You don't answer that thing?
It's very slightly present. My sinus is more open and also I ingest strong.
Your maxillary teeth numb now?
Yeah, on my lip and my cheek.
Not only that, it has to happen. Yes, yes.
Okay, let's test, put your hands like this. On the side. Okay, 1, 2, 3. More forward. 1, 2, 3. Front and back. In his history, he sent good response to Crown, and he also admitted to getting conquer beat up on his head some. So, Crown is a real good one, too. And it looks like it's not fully clear as far as Crown. You got a white?
Yeah.
I use a 32, but I don't like it as much, and so this slows you down. So I'm going to give the patient more time to touch.
The injections around the thyroid instantly gave me more energy. I could feel a surge and I started to find training. The ones around the head become dramatic sensations at a couple of points. The nose didn't seem to do it. My thyroid was quite amazing.
What I really like to know is it looks so nice right now. Of course, it'll fade, but I'm proud of the nose.
No, you didn't inject into the thyroid, you just injected over.
Oh, no, right in. Right in thyroid, sure. CC each pole.
And that was because of this MC.
Because we saw him last year, and we were watching Dr. Cocker do it, even President Hudson in the back again. Wow, this guy went from Frankenstein looking to back to the taxpayer type of look.
Bill, did you say you used the 32?
You know, it's interesting to note that even all reports in this book, that one amalgam will reduce the thyroid function by 10%.
We're using a 30. Normally I don't use that. I use a 27 1.5 polycoat. The 30s are too, well, they're great for the nose and face and stuff, but like to do a regular work like a crown and stuff, they're too wimpy with it. Bend up too much.
I got 27, but now
Yeah, of course.
Bill, you go just under the occipital ridge on your posterior.
No, this one yes, we do, but with this one, we're going at its biggest diameter.
So you're above the occipital.
Yeah, we're at how you measure the baby's head, basically, where you measure the baby's head.
I hadn't seen Simon probably for 6 months, approximately. And I noticed a big change in his face. It looks younger.
I don't know. I remember in the, where is it? Okay. Any dense, very interference field, period. How does that feel?
Little sore.
So he must have beat himself several times here. I don't know, because it's really kind of like this. How'd you hit that? So this is in a car accident?
From a bike.
Okay, so it doesn't feel nice. It's an interference field. So you can fool around with it, one is not testing in if you want to do this stuff. So we just said fix the flame. So it gives me some ammunition and good. Now give me some more. Just fill the rest up with saline and I'll get a decent lean.
various reactions. Some very deep, others the field reactions going on. I had some small shooting more shallow injections and it was painful, but line of energy wise
This man would be an excellent candidate to do the auto chemotherapy too. Some intravenous hydrogen peroxide therapy, some hypoallergic, knock out the virus, fungus, parasites, leaving no residue, some carbon dioxide water, or ozone or HBO or already. And to repeat, or get maximum effect. So you want to see your health testing? Don't touch your tongue. Don't do things. Real good lock. Excellent there. There's a crown. Don't get very real good.
Show what he's done here.
Okay, 1, 2, 3. This one we didn't muscle test. I know we did really good on this one. But he's got a lot, when they have a lot of tissue that's messed up, just tell them it's going to take us a while to get that to the max. That's done. Thank you.
Why don't we take a break now for 15 minutes, huh? Gary, Richard, please sit down.
I'm sure you're gonna do the same thing. Yeah, I appreciate
Please sit down.
We should have one there.
Andy, that fellow there doesn't have a badge. Get him out of here. Okay, we're gonna start in with chronic dangers in neural therapy. That's Blake. That's dangers. Yes, I know. Yeah. The dangers of neural therapy, and then they're going to go into chronic diseases, chronic tonsillitis, and appendicitis. So Albert.
Hemos considerado la importancia de esta charla muy rápidamente enumerar aquellos peligros, aquellos riesgos que se pueden incurrir en la terapia neural con la finalidad de tenerlos totalmente en cuenta durante la práctica.
We thought it of importance to mention, now that we have been talking about neural therapy for a couple of days, to also mention the risks and the dangers involved in a non-adequate application of neural therapy.
Podríamos determinar que los peligros de la terapia neural estarían con referencia al medicamento, con referencia al método, o sea, la forma de aplicación de la terapia, con respecto al paciente y con respecto al mismo terapeuta.
The danger that might be derived from neural therapy might be in relation to the neurotherapeuticum that we use, to the method itself, to the technique, to the patient, and to the one who is using the neural therapy.
Específicamente con respecto al mal medicamento, no habrá ningún problema siempre y cuando estemos empleando procaína al 1% o menos, que apliquemos microdosis de procaína. Recordémonos que no tenemos por qué invadir el tejido con procaína, simplemente la pequeña cantidad en el lugar exacto es suficiente, lo cual entonces nos permite tener una terapia segura, atóxica y sin riesgo de producir iatrogenia.
We must not forget that when we talk about the neurotherapeutic agent that we might use, there are several alternatives. We can use just procaine, that is what Hopper called the procaine hydrochloricum purum 1%, or any lidocaine derivatives, as Bill was saying, without any vasoconstrictor, without any additives, preservatives, etc. We should stay within the frame of a 1% solution or less. It can be much less, it can be 0.5%. And one of the things that is emphasized is that we stay at the level of microdoses. We can go higher, but there is no need to it. And then if we stay at those levels, we will be having a secure, a non-toxic, and non-iatrogenic therapeutic agent.
Siempre recomendamos el uso de procaína o novocaína, pero por favor tener mucho cuidado, no se debe emplear en terapia neural el uso de adrenalina, porque automáticamente nos convierte la terapia en una terapia muy tóxica. Entonces, peligro con la adrenalina.
One of the things that has to be observed for the ones that are going to do this for the first time is don't get stuck with procaine or novocaine plus adrenaline or any kind of vasoconstrictors, because at that very moment, out of something very helpful, you're turning into something that is very toxic.
Con respecto al método donde podríamos nosotros crear iatrogenia, estaría una de las aplicaciones a nivel del ganglio estrellado, donde podemos caer con una aplicación intraarterial en la carótida, donde si nos vamos en una sobredosis podemos producir presión en el seno carotidio, llevando a molestias en el ritmo cardíaco del paciente, donde podemos crear un neumotórax, o donde, si nos falla la esterilidad y la asepsia del método, podríamos crear un entierro.
If we talk about iatrogenity, in some of the injections that we do in neurotherapy, and we go to the stellatum ganglion, what could happen there? We could touch intraarterially into the carotid. We can, if we don't stay at the level of microdoses, more or less, we can give excessive doses and produce a pressure on the carotid sinus. We could produce a pneumothorax in some of the in these injections if we don't hold the angle as indicated, and if we don't observe the hygienic measure that has to be observed, we might be creating an empyema.
Con respecto al método, toda práctica de terapia neural que se haga en el terreno superior de cuello y cabeza tiene el riesgo de caer intraarterial y llevarnos entonces la procaína hacia el cerebro. Por lo tanto, cualquier proceso que se haga en este terreno obligatoriamente debe ir precedido de una aspiración para, en caso necesario, retirar la aguja.
One tends to become very folkloric if you have been doing it for too many years and forgets the aspiration. Any neurotherapeutic injection in this part of the body requires a previous, well, not the papules or the wheels, but any profound aspiration requires of the aspiration, because if you get intraarterially, all those arteries lead towards the brain.
El otro riesgo que podemos correr con respecto al método son los hematomas. Estos principalmente los vamos a encontrar en el ganglio ciliar, en el esfenopalatino que ya vimos, o en el troncal simpático. Por regla general, también el hematoma que podemos crear a nivel de las arterias, en las aplicaciones del suprapúbico, Frankenhäuser o en próstata. Por regla general, la única molestia que va a presentar es dolor, pero curan solos, simplemente ponemos un poco de hielo y se le explica al paciente.
The method itself carries another couple of risks, if you want to call them that way, and those are the hematomas that are basically possible when you inject the ciliary ganglion, and you might have quite a substantial hematoma. The sphenopalatine ganglion, the one that was injected here, once you touch the bone and you go into the angle towards the fossa pterico-palatina, there are a lot of smaller vessels that you might touch, and a spontaneous hematoma might come up immediately. So you have a blue cheek for some time. When you do the abdominal trunk line, you have the chance of hitting a major vessel, and that might produce a hematoma. And when you're doing the suprapubic injections, be it the gynecological or the prostate, and you don't palpate the arteria, you might have an arterial hematoma there. They're basically curative, as we saw yesterday when we were talking about the blood, but you have to advise the patient that they're painful, they're unpleasant, they don't look too good, but they go away alone, they disappear on their own.
Finalmente, está totalmente contraindicada la terapia neural en cualquier paciente que esté recibiendo anticoagulantes. No hay ninguna necesidad de correr este riesgo, por lo tanto, si en la historia clínica el paciente nos refiere el uso de anticoagulantes, eliminemos la terapia neural, utilicemos láser o abramos otro método.
One of the no conditions for neurotherapy is if the patient is under any kind of anticoagulant therapy. That's the kind of risk that we don't need to run. We have to ask the patient before we go at him with any kind of neurotherapeutic injection. And if he is under anticoagulant therapy, we just use laser or whatever other type of therapy we use.
Veamos entonces ahora sí algunos aspectos generales sobre las enfermedades crónicas.
Let's just look at a couple of general aspects on chronic diseases.
En primer lugar, las causas por las cuales un paciente puede llegar o irse hacia una fase crónica es por el paso de una fase aguda a una fase crónica.
How do we, just to get started, how do we end up in a chronic phase? Well, the most normal transition is when you go from the left side, as we were talking yesterday, we pass the biological cut and we land in a chronic phase.
Las dos causas principales para esta razón sería la quimioterapia, que bloqueándonos las fases agudas haga su acción retóxica y nos lleve el paciente a una fase crónica.
One of the major causes that precipitates you into a chronic phase is chemotherapy, because that inhibits all the left-sided phases and promotes a very rapid retoxic action that pushes us into the chronicity.
El otro punto de tener en cuenta son todas aquellas condiciones patológicas que pongan al paciente en inmunodeficiencia.
The other aspect that brings us very easily into chronicity is are all those pathologic conditions that cause immunodeficiency.
La otra causa para que nos aparezcan enfermedades crónicas pueden ser enfermedades que ocurran sin fase inflamatoria previa, generalmente debida a intoxicaciones.
Another type of diseases that might end up very easily in chronicity are those diseases that do not have a prelude of an inflammatory process due to the fact that there have been previous intoxication. So you just wipe off the left side and you land right away due to repetitive intoxications in your chronic phases.
Esto lo podemos encontrar cuando se emplea inadecuadamente medicamentos, Sobre todo, aquí creo que no se da, pero en nuestros países es muy frecuente que la persona siente alguna molestia y va y compra 2 o 3 pastillas de antibiótico o 2 o 3 analgésicos, etcétera, toma por un poco de días y hace tratamientos incompletos o inadecuados.
One of the main causes is medication. Ethical medication on one side. In our country, we see a lot through self-medication. People feel that they have a little sore throat, they go to the pharmacy, they buy a couple of tablets of antibiotic, and they treat themselves for a couple of days, you know. And that is one of the main reasons, medication that lead to chronic intoxication that make you land right away in chronicity.
Otro de los aspectos de tener muy en cuenta en fases, bloqueo de las fases inflamatorias y directamente a las fases crónicas, es el uso de insecticidas. Las microdosis pero permanentes de insecticidas que echamos en las casas, que echan en los cultivos, o las microdosis de insecticidas que vienen en los cultivos, van bloqueando las capacidades de reacciones inflamatorias del cuerpo, presentándose entonces directamente fases crónicas.
And we said yesterday that the world's population, some of it more than others, are walking very rapidly towards the right-sided phases. And one of the reasons are the insecticides. Microdoses of insecticides, homeopathic doses of insecticides that you eat with your salad, with your fruit,